I am here in Greece at the International Myeloma Society meeting in Athens, and I'm grateful because the organizers have included AL amyloidosis in 2 sessions here at the meeting. One session was about Meet the Professors, which was led by myself and Professor Ashu Wecklicker, who we had a great session with great attendance and many questions regarding management of patients with AL amyloidosis. The next session is occurring on Saturday morning on advances in AL amyloidosis, which is going to be presented by me, and I'm going to speak to you about advances in therapies in AL amyloidosis. There has been a marked progress in the outcomes of patients with AL amyloidosis as shown by a longitudinal natural history study of 40 years performed from Boston University Amyloidosis Center. The median survival of patients with AL amyloidosis has increased from 1.6 years in the mid-1980s to 4.5 years in the most contemporary era because of the expanding therapeutic landscape. However, we must look beyond the plasma cells as quality of life, organ dysfunction, organ failure, and survival are dependent on amyloid fibril deposition in the organs that lead to organ failure. Therefore, it is the new treatment paradigm should include combining therapies that stop the production of amyloidogenic free light chains along with stabilization of the misfolded light chains by a small molecule and or anti-fibril agents that would deplete the amyloid fibrils from the affected organs. There are several clinical trials that are ongoing with the anti-fibril agents. One of them is AFFIRM-AL trial, which is incorporating birtamimab, which is a fully humanized monoclonal antibody against the amyloid fibrils and the protofibrils or oligomers. And this clinical trial, this antibody or this novel agent was first tested in a phase 3 trial called VITAL trial, which was stopped because of futility. However, in a post hoc analysis of this trial, it was clear that patients with stage 4 Mayo 2012 staging system with advanced cardiac amyloidosis did benefit from birtamimab plus standard of care therapy with respect to all-cause mortality as well as functional assessment as well as quality of life assessment. Therefore, a confirmatory trial is being done in patients with Mayo 4 2012 staging system AL amyloidosis called AFFIRM-AL trial. The next molecule, which is an anti-fibril agent that is undergoing clinical investigation currently, is KALM-101 antibody. Again, phase 3 randomized clinical trials are ongoing, but in phase 1A/B open label studies, it was clear that KALM-101 leads to organ responses as measured by the biomarkers and bioimaging biomarkers of global longitudinal strain analysis. So the future is bright for AL amyloidosis. We await the results of these randomized clinical trials as a novel therapeutic target.